My name is Lorraine Johnson, and I'm the CEO of LymeDisease.org. We are the largest network communications network for Lyme disease.
LymeDisease.org, I was reading online, is that more of like a policy initiative? Mm-hmm. Is it a resource for people in terms of where they can find Lyme literate doctors? What's the focus?
So what we try to do is we try to empower patients, and we do that by providing them with information they need. We do that by giving them legislative tools that they may need, and we've also developed a large patient registry platform that actually allows them to pull data for research.
A vital and probably missing tool in this fight for this during this illness, right?
Right. All of these are tools that have been missing. I mean, 10 years ago, people couldn't find information on Lyme disease. They, maybe they tried to look it up in a medical journal, but the medical journals, you had to have access. And they couldn't pass legislation easily because they were in, separate communities. They couldn't really come together in the way that maybe a healthy population could because they were sick. And so technology provides the tools to allow legislation to move, and it also provides the tools to allow patients to start becoming involved in contributing healthcare data, part of the big data movement, to start making some change.
And really, LymeDisease.org is sort of the epicenter of that in a lot of ways, right? It's a place where somebody can go and see and get reliable information because there's so much out there on the internet, fortunately and unfortunately.
Yeah. Well, that's true. I mean, that's what we try to do. We try to provide accurate information for patients, and we try to provide a place where we can engage them. We've been a grassroots organization for the past 29 years, and that's what we do. We keep a dialogue going with the patients. So if we're doing something in healthcare policy, we might say, maybe we're meeting with the Food and Drug Administration. We might say, tell us what you think to the patients. We'll send out a survey. We'll get back 9,000 responses. We'll go to the FDA and say, not here's what I think, or here's what the organization thinks, but here's what 9,000 patients think. And that has a kind of power, there's power in numbers that you really can't get when an individual has to operate as an individual operator.
What I have found frustrating in doing some research on this is that if you Google cancer,
yes,
my goodness, the resources that come up, and rightfully so because of what a horrific illness that is. If you do that for AIDS, if you do that for MS, Alzheimer's, and on, so many worthy causes that need research funding and attention.
Right.
But when you Google Lyme disease, you kind of get everything and anything. You don't know what's right, what's wrong, what's with a twinge of
bias.
Bias, exactly. So I find that very frustrating as somebody just trying to research it. I imagine from a patient standpoint, that's incredibly frustrating.
Oh, it's really hard. It's really hard for patients to navigate the system. It's hard for cancer patients to navigate the system. But for Lyme patients, it's doubly hard because you have to find a physician to treat you. You have to find a physician who actually knows about the disease. Many physicians don't. You might be in a state where it's not really common, and so getting a diagnosis is much tougher, and the testing is bad. So it's very hard for patients to understand, why isn't the test good? Why can't I just go in and have a simple diagnosis? But it's just not that simple, and you have to have the resources. In this case, we're talking about the right physicians looking at you to help you navigate your way through the healthcare system.
Talk a little bit more about the power that you yield with the FDA, with the government, because that seems to be the adversary here, right? It's the government that isn't doing regulating the test properly, isn't jumping on board with this being a chronic illness.
Yes.
Talk about that.
Well, what's really happened is there's been a lot of polarization within the research community. So you've had a group of researchers who've said, oh, Lyme's easy to diagnose, treat, that's no problem. And then you have the patient experience, which is vastly different. The patient experience is a very difficult disease to get diagnosed, a very difficult disease to get treated. I mean, we found in our, in My Lyme Data, our patient registry, we found that 80% of the people who were in the registry weren't diagnosed until late. So they weren't diagnosed until 6 months or so after they'd contracted the disease. That's really a hard time to start treatment. And so putting together those sort of pieces really matter.
Yeah, absolutely. And let's just also talk about that online petition that your organization was at the epicenter of. Explain it to me, tell me about it, and tell me why it's so important.
Well, we did a petition that was about bringing down the IDSA guidelines, the Infectious Diseases Society of America guidelines, from the clearinghouse, the National Clearinghouse, which, they put up guidelines that are evidence-based. And we felt that those guidelines should come down because they were out of date. And that, I think, had some influence because people saw that there was a patient voice here. I mean, the main problem that we've had in Lyme disease has been that the patients have been excluded from almost all of the dialogue and conversation. So you have researchers making assumptions who haven't talked to patients. You have researchers, for instance, a researcher might say, oh, co-infections, where you get more than one infection from a tick bite, those are uncommon. Those are really rare. But we find when we survey the patients with chronic Lyme disease that about 50% have co-infections. So they're not rare at all, but maybe we're talking about two different populations, people who are diagnosed early and people who are diagnosed late.
So in Massachusetts especially, you guys, LymeDisease.org worked closely with advocates there, is my understanding, to issue this petition to override the veto. Tell me a little bit about that.
Yes, this was a legislative action, and this was really interesting because we worked very closely with the people on the ground, are the true heroes, and work with a legislator to make things happen. But at the pivotal moments, when they were trying to get things through the House and when they were trying to get things through their Senate, we were able to marshal, the patients together because we have access to a lot of patients, and we used a tool called Voter Voice, which just simply, it's a technological tool that allows people to very quickly see what is needed legislatively, what they can do, in 5 seconds. It takes no time. And this thing in Massachusetts, it ended up being this really intricate little dance. It was like the governor, vetoes it at, Friday at the end of the day, and then over the weekend you've got to get the House and the Senate to overturn that veto, and it required a lot of intricate messages. But we were able to go back and forth with the community, and we drew in over 4,000 responses and letters to the legislators in Massachusetts from Massachusetts residents. So it was able to have a big impact in terms of how things played out at the end.
A big impact, as in you got that override veto.
Right, and it wasn't just us. I mean, the people, we only work with the people on the ground who are the people who really know their legislators and who know what's going on. But this was a situation where we could be in really close contact and communication with them and just help amplify the efforts that they were doing.
On a sort of a micro level, did you find that the more that you dealt with these legislators, the more that you explained the fight, that they were more willing to understand where you were coming from or how important this was?
Well, it's interesting. I think, if you look at what happened after the legislation was passed, the legislators there said, everybody in this room knows somebody with Lyme disease. So that's what's beginning to happen, is people are beginning to be touched by Lyme, their family members, their friends. In Massachusetts, which is a highly endemic area, a lot of people have Lyme disease. So now it's at the point where the epidemic has grown so large that people are beginning to have a personal connection with it.
That must be like eureka for you, right?
Yes. Well, I mean, you hate to see so many people sick, but what you really like is you like the fact that people are beginning to get it, that, legislators are willing to step forward and do the right thing and try to provide care for patients who, have really had a hard time getting insurance coverage.
My last question to you is about social media. Everybody that we have heard from, and many of whom are not necessarily in New York, New Jersey, Connecticut. They're from all different parts of the country that heard about our special, all different parts of the world, Australia, Argentina, Netherlands, on and on and on. They all say the same thing. This is such a lonely disease that they turn to social media as sort of that helping hand or that shoulder to cry on, although they don't know many of the people that they're interacting with. How, in your opinion, has social media changed the game and change the path forward with this illness?
I think social media has been a real game changer. We were doing surveys on a single piece of paper, waiting a year for 100 respondents 10 years ago. Today, we'll get 9,000 responses in a month. So, and that's because technology tools just make it really easy to get the information out there, make it really easy for patients to respond. And it's the same thing with, if you're trying to find out what the incidence is of, say, MS, how many people were misdiagnosed with MS initially and turned out to have Lyme. You can go, we did a blog post, we said, give us your comments. We had 900 people take a survey, a little survey telling us what was going on with them in terms of them having been misdiagnosed with MS. So you can start a dialogue in a way that you couldn't before. It's not just distributing information to the community. It's asking questions of the community, taking what they say, amplifying it, taking it to healthcare policymakers, and trying to create change. And we're doing that in research now too.
Do you foresee a world or an environment, or at least a United States, where Lyme disease is as accepted as some of the other healthcare battles that people had fought in decades past?
Well, I mean, that's an interesting question, because it almost asks, do you think the historical institutions that have helped all of these other diseases are going to help Lyme disease? And I think the last study that was done on chronic Lyme disease treatment in the US was 14 years ago. It had 129 people that were enrolled. I don't think that we should be waiting for other people to come in to rescue us. Today we have tools where patients can pool their data. We have 6,000 people in my Lyme data so far. Our goal is 10,000. It'll be the largest study of Lyme disease ever done. And that's a tool that wasn't available 10 years ago. You simply couldn't do the sorts of things you can do today. And it's because of technology.
All right, anything else that you'd like to add? Anything that you think our viewers need to know from your perspective, certainly your organization?
Yeah, well, I think the most important thing right now is to empower patients. Patients have been left out of all of the equations. Research study design they haven't been involved in. They haven't been involved in helping to analyze the research, determining what populations were included in research. So we end up with research that really hasn't been useful for Lyme patients. So what I think needs to happen is we need to put Lyme patients back in the center. We need to start giving them a voice. They need to be able to start making social change, and they need to start having a larger role in the research agenda.